If you've ever cooked one of these things, they literally ignite on the barbecue. Um, but they do taste like meats. These are not the healthy foods that I want you to eat. So if you said, oh, once a year I'm going to have a half a burger on my birthday, like fine. But I would do your best to really eat like a peasant, which is unprocessed, unadulterated foods that come out of the earth and look like they do when they come out of the earth. So oats and grains and vegetables and fruits and limited amounts of any of the processed stuff. And remember, there is vegan junk food galore. We have figured out every gap in our food where we can find a plant-based version of something, right? I remember before aquafaba was invented, no, everyone's like, oh, we can't make meringues. Now we can. So again, I think we have figured it out. You can find a vegan candy bar that tastes just like what you used to have when you were growing up. Again, these should be used very sparingly.
And for the sake of the audience, aquafaba is.
That's the liquid that comes off of chickpeas that can actually be whipped up into a meringue. It's really just a starchy protein. That's what the egg stuff used to do to make meringue. So
Thank you. So, coconut oil is often touted as a health food, and I think it was extremely popular for a while. Now I'm hearing a lot more pushback on that, specifically because of its saturated fat content. What are your thoughts on coconut oil as a healthy food, to the extent that it is not, in your opinion? If that is your opinion, why not?
yeah, so coconut oil actually has more saturated fat than lard. So I don't recommend people consume it regularly. It's excellent topically, except if you live in a cold climate. When it hits the cold pipes, it tends to congeal, which creates a lot of problems. So in general, I'd recommend that people eat whole coconuts or just the coconut water, and try their best to limit, if any, coconut oil. If you look at our professional society guidelines, we call out specifically the avoidance of tropical oils, and that includes palm oil as well.
And what is the impact of something like coconut oil on cholesterol?
Believe it or not, this was before my time in cardiology, but they actually used to feed rats coconut oil in an effort to induce a very atherosclerotic state with very high cholesterol levels. So I don't recommend that people consume this in large quantities. Now, it is truly tasty and decadent. So again, I get that occasional splurge might happen, but wouldn't recommend. There are people who are literally taking chunks of this and putting it in their coffee every day. I really don't think that's a good plan.
So, what is your response to studies suggesting that moderate meat consumption does not negatively impact cardiovascular health?
Most of those studies are flawed or have been underwritten by the meat industry. Believe it or not, the beef industry actually has an entire lobbying effort and actually has a bunch of paid scientists that will try to publish data like this. So what I usually tell people is, in general, if you think that's the case, it's definitely not the case for the environment. And the data is very, very clear on beef production and the environment. And of course, environmental health and our health are intimately entwined. But that said, if you said to me, look, once a year I have a bite of a hamburger or something like that, again, why would you? Why do you even bother? That's probably not going to harm you. It's kind of like if I smoke one cigarette or have a few puffs once in a great while, probably not harmful, but why would you even tempt fate? So my strong suggestion to people is to stay away from it. And of course, if you look at the amount of toxins, feces, bacteria, mad cow disease, whatever that comes with all these awful things and the way they're farmed and produced, you probably would stay away from them. If you want to, go vegan tonight, if you're not already there, there's a lovely movie called Earthlings, which you may have seen by Joaquin Phoenix as the narrator. It is truly eye-opening and really shows you where your animal products come from. And that, for me, was more than enough, despite even the health information and environmental information.
So we have a speaker, John Abramson, Dr. John Abramson, from Harvard, who wrote a book called Sickening, in which he talks about how big pharma has co-opted a lot of the major peer-reviewed journals. How hard is it for doctors to, much less the lay people, to find the truth, given also, I don't know if you agree with this, but how hard is it to find the truth, given that these journals have been, at least nudged, if not completely overtaken by the pharmaceutical industry?
Yeah, they're probably not overtaken by the pharmaceutical industry, but there is definitely influence, and there's influence over all of us doctors in lots of different ways, even in the educational stages of our career. And again, statistics is a very challenging field and can be manipulated in a way that's difficult to understand, which is why many of us might not look at one study, but a series of studies to find a signal in some of the noise that's out there. I do think that the vast majority of pharmaceuticals help, but many of them are actually modest in their effect. I alluded to this earlier, but if you look at some of the blood pressure trials, the mean effect on blood pressure is sometimes as little as a drop in 3 millimeters of mercury, which is not a very big drop. Now, of course, those are all comers. Some people have a big drop and some people have a little drop. So again, the more you peel back the curtain, the more you kind of are like, well, is there a big great signal? Is there not? This is why a lot of us doctors do journal clubs where we critically review the journals. And most of the better journals have better reviewers where they actually will, tease out this stuff. But I would agree with you that sometimes it is difficult to know the truth. And sometimes the trials are very overly purified, meaning that they have controlled for every possible confounder, which makes it completely unlike the real world. And so you'll often see in the limitation sections of most papers, this was not a real world trial. This may not be generalizable to the general population. And so that's why we rely on multiple studies showing different facets of the drug that's being studied to get to the bottom of things. But more and more, you're seeing negative trials being published. They used to not be published at all. There were actually a couple. I was just at the American College of Cardiology meeting in Atlanta, and they used to not publish them at all. And now they publish them routinely. So I think that people are clear that there is a lot that can be misconstrued, and it takes a sciencey minded person to understand that. And I think people that are calling truths do a really good job, like Neil Barnard and the PCRM actually comb through the literature regularly, as do I. And I try to pull out the studies that make the most sense to me. I guess what I would tell you is, pharmaceuticals are not necessarily the enemy. But again, when you're on a drug for your life, who does it benefit? Usually the pharmaceutical company. Although a lot of the drugs that I use, if you were to look at my prescribing habits, are all generic, right? So, a whole year supply might cost someone $50. So I'm about using the evidence to improve health outcomes. And there are patients that I take care of who say, Doc, I love that you are trying to give me the best of the best. I won't take a single pharmaceutical. What can I do? And we come up with other strategies, and they may be leaving some risk on the table. But again, it's a very individualized, patient-centric discussion that needs to occur.
So, so as a peer reviewer of some of the studies in these journals, what information do you get? According to John Abramson, some of these studies, when they're peer reviewed, the peer reviewers only get the study design and the conclusion, not the source material. Is that common? Is that rare?
Oh, yeah. Well, you get the data that's included in the study. Now, you could certainly make requests, and you can usually, with the data that's published, you can usually you can redo your own statistics. And actually, Neil Barnard and his group of statisticians do that commonly. But I would say that in general, you usually get enough. And yes, there are statistical reviewers that actually go through the data for many of the studies in many of the bigger journals to make sure that those are accurate. But yes, I am not getting Excel spreadsheets or databases with all of the raw data, nor do I have the time or ability to understand how to process all of those in a statistical way.
And what sources are good as far as if people, either medical professionals, which we have some medical professionals listening, as well as the layperson, if they wanted to read up on particular studies in a given journal, what journals and what sources would you recommend people check out for their integrity, if you will?
Yeah, I mean it's difficult to do. So you can look at something called an impact factor, which means how much that journal is read, reviewed, and looked at. Those are powerful, and the bigger journals, the better journals, have higher impact factors. But every professional society and the doctors that belong to professional society could probably list them off depending on the disease state. So for in cardiology, right, the Journal of the American College of Cardiology, JAMA Cardiology, American Heart Association Journal, Circulation, to name a few. And then you may have seen more recently, Neil Barnard and his group have been finding that the folks at Nutrients, which used to be a very respected journal, have had more issues with some of their analyses lately. So bottom line is, I think it is a constantly changing answer to that question. And, you should expect or at least hope that the people that are taking care of you are knowledgeable in this space.
So, what does the latest evidence say between the link between dairy consumption and cardiovascular health?
Yeah, so dairy is the number one source of saturated fat in the American diet, and I usually recommend avoiding it altogether. But dairy is also very inflammatory. There's actually a lot more data for dairy and different types of cancer. Remember that we are the only species on the planet that drinks another animal's mother's milk. And when you think about that for a second, it's really strange, right? Like, so if you live in Siberia and you can't grow a vegetable or whatever, sure, you might need a cow or a pig or something to survive. But most of us don't live in that type of situation. So imagine, if you went to the newborn nursery wing of a hospital and there were little animals looking for snacks, it would be a weird concept. And it's something that we also have to say, okay, yes, cow milk is the perfect food for making a baby calf turn into a giant cow in 6 months. And another word for that growth in the medical jargon is cancer, which is why in humans we see more breast, prostate, and other types of cancer. But I think the saturated fat and the inflammatory cascade that occurs from drinking dairy milk is probably what leads to more cardiovascular disease. And I usually tell people to avoid it.
Thank you. So, what are your thoughts on the use of plant-based diets in pediatric populations for cardiovascular disease?
Again, from birth, I recommend it. And in fact, the American Academy of Pediatrics and amongst others have also peeled back many of their dairy recommendations because the American population is so fat. And so, with childhood obesity at record levels, figuring out how to reduce calories is important. And it turns out that if you eat a plant based diet, it's naturally lower in calories. And if it's done well, there's really no risk. And there's been lots of studies published over the years that I've actually covered in all of my different talks over the years that show that your kids are going to grow up just fine. They're not going to have little pinheads and be weak and all these terrible things you hear people say. They're going to be normal people just like you and me. And so it's difficult for people to grasp that because, again, the vast majority of people are not growing up with that type of diet and they don't want to give their kids that type of diet. But I would tell you that there's nothing wrong with this. And if you go to many parts of the world, their kids live on rice and beans, and that's it for a lot of years, and they do just fine. So,
Thank you. How do you see the future of cardiology evolving with the growing emphasis on prevention through diet and lifestyle?
well, as one of my good friends and mentors, Kim Williams, said, he wanted to make cardiovascular disease number two. He also said something very controversial. He said there's two types of cardiologists in the world, right? Those who are plant based and those who don't know the data. So I'm hoping that the knowledge and the passion and the desire for the success of the human race and society will depend on how well we prevent disease. Because what we have right now is an unsustainable, costly mess in most of the Western world. And we have favored making money off of people rather than their health. And so we have to change that concept in a hurry worldwide so that we can live the way we were intended to live without all of the disease and cost that goes with it.
So speaking of Dr. Kim Williams, we had him on the other day, and one of the things that he says that I enjoy is that he wants to make cardiovascular disease no longer the number one killer of cardiologists, which I
That's
think.
also true. So, there's actually been a number of articles written on the fact that we medical professionals are terrible at taking care of ourselves. And in that study that I referenced, where we surveyed 1,000 cardiologists, we asked how many fruits and vegetables the average cardiologist was eating, and most were eating one or less per day. So it's pretty scary, unfortunately.
So can you describe the research process behind one of your published manuscripts on plant-based nutrition?
Yeah, so some of them are actual survey based where we just publish the results and go from there. And then the vast majority of my written work has actually been reviews of the literature. So we wrote a couple of very popular papers called Trending Nutritional Controversies, which I would encourage you all to check out. You can find them in several different high tier medical journals. And what we normally do is we get a consensus, we get a group of very knowledgeable and scientifically oriented cardiologists who are knowledgeable in the nutrition space together, and we choose the topics we want to talk about. We review the literature, we write it, and we cite the literature very carefully, and then we send it in. And we hope that a reviewer reviews it in an objective way and says that they like it and think it'll add to the knowledge base of the world. And I know that sounds like an overly simplified process, but that's basically what it is. And I think, I wouldn't call myself an outcomes researcher or a bench researcher, but I definitely have surveyed people, so some quantitative research that way. And then I certainly write more reviews. So,
What would be one thing that people would be surprised to learn about cardiovascular disease?
I think that cardiovascular disease is actually much more of a behavioral disease than most people would ever think about. I mean, I spend most of my time trying to change people's habits and the way they live, which sounds crazy when you think about it. I'm not a psychologist, I'm not a psychiatrist. My psychologic training is relatively limited, but I think that the way we apply medicine is through behavior change and something called motivational interviewing, which is a technique we use where we look for people's interests in an effort to improve their outcomes and change their behavior.
And when you are meeting with a patient, is there anything that is a good indicator whether or not they're going to follow something? Like, for example, if somebody is really severely sick, are they more likely to follow your protocol? Or is there any other indicator that leads you to believe that they'll be more likely to be a willing participant in their own health?
Well, I mean, there's a lot of indicators out there. I mean, one of the more common things I always tell people is that when they sit in the chair next to me and they say they're going to try to do something, it's almost as if they said a four-letter word to me, right? So I want people to leave and say, I'm going to do this. You know, one of the wisest things Yoda, the little green guy from Star Wars, said, right? He said, do or do not, there is no try.